Welcome to People. I'm Micah Mater. With a summer surge that knocked a lot of people off their feet, many are wondering what to expect from COVID this fall. Plus, it's National Vaccination Month. What shot should we be considering? The doctors are in. Here to answer those questions and more are Dr. Ngozi Ezike from Sinai Health and Dr. Jeffrey Sterling, President and CEO of Simcoe Managed Health. Thank you both for coming in.
Thanks for having us.
I love to do this, to talk, to give us, to inform people what's going on. Now, we heard through the grapevine that there was a new COVID surge right now.
Yeah, I think people can just tell from the amount of people that they're getting I got COVID.
The president had it, yeah.
So definitely we've seen an acute surge, and we also know that typically as we move indoors outside of summer into fall, there's usually more surges associated with that if this virus follows those normal patterns.
So, Dr. Sterling, give me an idea of how bad this COVID is. I mean, both say it'll be with us forever, but this is milder, right?
Unless you're the person that gets it. Right now, about 1.5% of deaths across the country are due to COVID. Still, which is lower than it was during peak pandemic times, but of course that's significant. And 2.5% of emergency department visits right now in the summer, not in the fall, not during respiratory season, are still due to COVID. It's out there, but people shouldn't be surprised. Life finds a way, even if it's a virus that's trying to find a way to live.
Should we just say, well, we're going to get it anyway, let's just go on, forget the mask, forget the vaccinations and things like that?
I think people need to assess their risk status. If you're immunocompromised, that's different than someone who's maybe 30 and no health conditions at all. And so really taking into account maybe not just your health status, but the people that you're around that you might also be responsible for trying to protect will help you make decisions on how aggressive you need to be in preventing infection.
Is there a new vaccination out right now, or is it coming?
Both.
Okay.
There's a vaccination that covers the last major strains that cause increases, but there's always a lag.
So should we get that or wait for the new one?
You absolutely should get it. You
Really?
should always be as protected. This is all about risk reduction, and you want to lower your risk as much as possible. You're never 100% safe, but in as much as you can lower your risk incrementally, you should take those steps that are going to accomplish that.
Okay, COVID's not the only thing out there right now, and it is vaccination month, and probably doing it now because you're getting ready for the school year, right? So what should we be out there getting and, taking and all that fun stuff?
We always have to remember our friend the flu shot, and this is usually a time that it's a great time to get your flu shot. You don't want to wait till everyone around you is having symptoms of the flu. It takes weeks to actually mount that immunity. So the earlier you get it, have it on board. Again, you want to be preventive and work before that full-on flu season and the peak hits.
Besides flu, what should we be getting?
Well, the flu.
Besides the flu shot.
The reason I hesitated there is because, hard stop. There's still about 30,000 people this year who are going to die from the flu.
Oh my goodness.
So
you've got all sorts of fun stuff today.
There's a lot of them. So common things happen commonly. And COVID and flu, really, that's where the bullseye are. But to answer your question, there are other things. You're going to be talking about RSV in selected populations again.
Oh, yeah.
You're going to be talking about pneumonia in other populations. But common things happen common. And the good part about that is that this isn't just a conversation about vaccinations. There are some pretty simple steps that everyone already has the tools to implement that are just as good, relatively speaking, as getting that vaccine.
Like what?
Well, you and I, for example, we're 6 feet apart.
Yeah.
That if you can learn how to operate at that level of distance with most of the people that you're around, you're in pretty good space.
Yeah.
Because if the virus isn't being transmitted through conversation, singing, yelling, coughing, or sneezing, then it can't get to you. And again, if you know that you're in high risk situations, such as indoors, or if you're at some big gathering, it's no crime to pull out a mask. And as she pointed out, sometimes you're doing it for yourself, but sometimes you're doing it to be considered to others.
Your grandmother or other people who are immunocompromised.
There's a hierarchy in who is at highest risk to actually have the worst consequences. And one more quick thing about why you should be concerned instead of just being benevolent towards your neighbors. This is still early enough in the game that we really don't know what's happening with long COVID. And some people are going to find out what they don't know or what they're assuming is going to be benign. And if you can avoid it by doing some simple things, you really would do well to try to do that.
Now, the big thing right now, everywhere you look, is self-care. What is self-care? For those at home saying, well, I take a bath every night. Isn't that self-care? I mean, what exactly are we talking? Mentally, physically, emotionally?
see all of the above,
Okay.
right? And no, I mean, self-care is that. It's caring for self. And it can be, literally, that is, if I'm in a warm bath with some Epsom salt, I am caring for myself.
Okay.
Walks, peaceful walks where I may actually put the phone down and I'm just walking and getting fresh air, whether that's at lunchtime, early in the morning, maybe in the evening, that can be great. So I think it depends on what you need to care for yourself, but remembering that self-care is not selfish, it's necessary. We spend a lot of time taking care of all the ones around us,
Yeah,
but
that's what's important.
At some point, you've got to put the oxygen mask on for yourself.
First,
right?
Especially women, and not to keep you out of that. But so you're doing a panel for DNC. Tell us about that quickly.
Well, there's so much, and again, piggybacking off of the concept of self-care.
Yeah.
The topic of the day is just that, empowering people to be better stewards of their own health care. And we want to talk about how you need to stay healthy so you don't have to get well. And the same things that you're talking about in terms of self-care, we already know this stuff. An apple a day keeps the doctor away. Some level of activity, every level of activity strengthens your heart function. Just the basics. And the more that people start thinking about preventive health measures instead of sick care or curative care remedies once disease presents, the better off we're all going to be. And I'm just continuing to preach that notion to as many people as we can get in front.
Tell us about the 5K that's going on.
Yes, Run the Lawn. You can get more information at runthelawn.org. It's going to be happening at Marquette Park. A 5K walk, a 5K run, but there
Can you walk too?
Yeah,
Okay.
there's a walk and roll for those who don't want to run.
Right.
It's Sunday, September 22nd in Marquette Park, and there'll also be a health fair, and so you can meet some of the doctors from Holy Cross, which is right across the street, and get some health information and meet the doctors and ask your questions and do all the screenings that can help you get ready to care for yourself.
See, I love that when the doctors are made available to you, because a lot of people aren't going to go to the hospital, and if they're right there for free to talk to you, they're going to take advantage.
That's right.
All right. Thank you both. I love having you guys in. We'll be back when the fall and really stuff hits.